Hello, and welcome to part 2 of the 3-part web video series for nursing departments on the Nurse Ready Room model. Part 2 is who prepares our Nurse Ready Room. Hello, I'm Brian Harriott. I'm the CEO and founder of ReadyList Incorporated, a healthcare software firm, and former director of hospital operations at UCSF Health. I would urge you, if you haven't first watched the first video, what is a Nurse Ready Room, to go back and watch that at first before starting the second video and then ultimately the third video. In our discussion today, we will talk not only about who prepares a Nurse Ready Room, but also about the challenges. Why is it so hard? It doesn't seem like it should be so hard, but it is difficult. And always remember, nurses should be nursing, not finding and cleaning infusion pumps. So quickly, and first a reminder, what is the Nurse Ready Patient Room? The Nurse Ready Patient Room is the dream of a nurse. It's a patient room where, upon a new patient admission, they can walk into the room and know that everything is there where it needs to be, perfectly cleaned, and ready for them to begin patient care quickly and effectively. Cleaning protocols are known and followed. The right equipment is there, not only for the unit, but ideally for even the type of patient that's being seen. There is proactive room set up in terms of anything that might be noticed to be missing during bed turnover is identified, ordered, and received to the room before the nurse ever enters it. And operations are standardized so that no matter who is setting up the room, it's always done correctly. Not only that, but we have support service departments that maintain departmental metrics and continue to make improvements so that the room is set up better and better. And we have a strong partnership between the support service teams and nursing, ultimately to be able to deliver on an extremely suitable environment for patient care. So we'll talk about now who prepares a Nurse Ready Room, and this is where we begin to see how complicated it is. We have, what can be oftentimes siloed support service departments, all working very hard, but sometimes independently of each other. And the result is everyone doing their job greatly, but sometimes it's not always coming together as it should be. And as the nurse, you are the last line of defense, but before the patient experience. And so oftentimes when things don't quite line up perfectly, you are the one that has to do the manual workaround in order to get it working. I recently came across an article out of Harvard University that was done on for a study of Kaiser Permanente, several of their facilities, and they noticed that approximately 12% of a nurse's time is on manual workarounds to get through the day. And think about that. That's about equivalent to 1 hour, of a given shift. And that's just a lot of time. And not only that, as I've mentioned that to, nurse leaders, as I come, in contact with them, they often remark that seems even a little bit low. So let's first look at the environmental services team. And this is kind of, I would consider, the primary support service department responsible for ensuring a great bed turnover. Obviously they're concerned first and foremost with cleaning, whether it's regular discharge cleaning or isolation cleaning, based on the prevalence or existence of hospital-acquired infections. That is a huge focus point for them, is obviously cleaning. But sometimes environmental services is also responsible for setting equipment, and to some degree, setting supplies. It essentially varies by medical center. I'm going to go across to the next one on the top, and that's clinical engineering or bioengineering, depending upon what your department is called at your facility. But these individuals obviously are focused on making sure that the equipment is being serviced, has the appropriate preventative maintenance, and it's working appropriately. They are typically not cleaning the equipment, but they are ultimately responsible for the functioning of the equipment. And as I continue to move in a clockwise direction, there are many others that are involved in turning over a room, from material services, who runs equipment, runs supplies, linens also, respiratory services, who may be responsible for ensuring ventilator setup and cleaning, facilities if there are issues with the room, such as broken clocks or holes in the wall or things of that nature. And you may even need to get security involved if there's locked cabinets and a previous patient might have left clothing or some other valuables. And so, all of these departments are involved and need to be pulled to the room. And how is that done in a streamlined manner? And then last but not least, we have the nursing assistants, which often are kind of, that last step prior to the new patient, coming into the room, and you as a nurse beginning care for that patient. And they're obviously responsible for more case-specific equipment, a lot of times supplies and things like that. So all of these groups, individually have a key role in ensuring that that room is set up correctly. Now, nurseready obviously has its inherent challenges, and I alluded to some of them earlier. Oftentimes these support departments are in the basement. They're isolated from patient care. What that might mean is they don't know the ultimate goal, right? They know their job, but not the ultimate goal. And not only that, but these are departments that are often understaffed because they're not revenue generating departments. They're cost centers. So there's always work in this new environment that we live in to bring down costs, and often it's these support departments that are hurt. Now that said, they are also sometimes the lowest paid staff, right, and with the highest turnover. So what I'm saying here is that there's job turnover, so there's continual education, and there's always an effort to make sure that everything is being done to make sure that these folks know how this should all be done correctly. Performance is difficult to measure because a lot of times work done by these groups is managed by paper and pen, and it requires a lot of analysis and number crunching in order to try to come up with some metric to help improve upon. And also there's sometimes unclear expectations, and this is an argument that the support service department may take. And so when they're setting up a room, for example, they may get advice from one particular nurse who happens to be working that shift on how she believes the room should be set up. And then, down the hall where another, in another room where a different nurse is working, there may be different expectations. So that's hard on the support service team as well. And in that case, they just don't know if they're doing right in either case. And then, as I had mentioned on the previous slide, ultimately, these departments are operating many times independently, and in pursuit of this goal to turn over the room. And the result is that while extremely hardworking, they're often working at odds with each other and at odds with nursing, and that doesn't result in a nurse-ready patient room. All right, so stay tuned for part 3 of our educational video series. This is where we see how it all comes together. How do these support service teams work together in a streamlined fashion to make sure that they benefit you, the nurse, and set up a perfect room? In the meantime, visit us at nursereadyroom.com for more information, and I look forward to speaking with you again in video number 3, where we look at one particular medical center and the work that they did to bring together a wonderful nurse-ready room model. Thank you.